Leigh-Anne Stafford, Oakland County Director of Health and Human Services. We're here today to provide our weekly COVID-19 vaccine update. The state's COVID-19 vaccine dashboard reports just over 300,000 doses have been given to Oakland County residents, with 70,000 of those doses administered by Oakland County Health Division. Over 150,000 of those doses have been provided to Oakland County residents over the age of 65. This is 49% of all the doses given to Oakland County residents. We are very encouraged by the availability of a third vaccine from Johnson & Johnson that increased our vaccine supply this week. We are expecting to receive 6,700 doses of this new vaccine. This was in addition to the over 20,000 doses of Pfizer and Moderna we also received. I have with us our medical director, Dr. Russell Faust, and he's going to talk to us a little bit about the Johnson & Johnson vaccine. Dr. Faust, what can you tell us about Johnson & Johnson vaccine?
Well, first off, I'm excited just to have more vaccine. Obviously we need more vaccine. There are more vaccines in the pipeline, but it's wonderful that JNJ, Johnson & Johnson is finally with us. I'm also excited about some particulars of this vaccine. Unlike the previous vaccines, Pfizer and Moderna, this is a single dose vaccine. So for those folks that have some difficulty getting into the vaccine clinic or are out in long-term care or homebound or what have you, this may be very beneficial and get them vaccinated. In addition, I do want to say one brief comment about people comparing the, quote, success rate or efficacy of this vaccine to the Pfizer and Moderna. And I want to be very clear about this. The Pfizer and Moderna vaccines clinical trials ran many months ago, kind of toward the early part of this pandemic when there were no variants. And now obviously everybody's hearing about these variants, and the JNJ vaccine clinical trials have been run recently. And so we're really comparing apples to oranges. Despite that, the JNJ vaccine has been very successful and is at least 85% or better success rate at preventing severe disease and death, which is really what this is about. So for me, I have no problem with recommending the J&J vaccine to my own family members or myself if I weren't already vaccinated. What else can I tell you about it? That's about it.
Well,
I do want to advise people not to be brand shopping for vaccines. So when you are called or emailed and invited to make an appointment to be vaccinated, please get vaccinated. Do not hesitate. This is the way we're going to end this pandemic.
That's great information, Dr. Faust. Thank you so much. Please keep in mind that we are unable to place individuals on a separate waiting list depending on your preferred vaccine type. We understand, though, that you may have some hesitancy about getting the COVID-19 vaccine. Dr. Faust, what are some things to consider that people should, think about when they decide whether or not to get vaccinated?
I'll tell you, again, this is the only way we'll end this pandemic. All of these vaccines have been vetted for safety. They've been run through phase 1, phase 2, phase 3 clinical trials. They haven't necessarily completed all the paperwork, and FDA hasn't done all the extensive data analysis that they're conducting now to have full FDA approval. But the emergency use authorization during this global pandemic and national emergency doesn't really give it short shrift. It's not a shortcut. They've thoroughly reviewed the safety and efficacy of these vaccines. They are absolutely safe, and for all of these clinical trials, there have been no severe adverse reactions for the clinical trials. And I want to reassure people, and in addition, these vaccines, all three of them, unlike previous vaccines that we've used, are entirely safe for anyone who's on various medications, especially these immunosuppression medications that people are using now for rheumatoid arthritis, for example. But anyone who is immunosuppressed, has HIV, cancer, is on chemotherapy, is fully safe to be vaccinated with these vaccines. So I want to reassure people. And again, if you have the opportunity, don't hesitate. Get vaccinated.
Well, that's great information. Thank you, Dr. Faust. We just want to remind people about our website. Our vaccine website is oaklandcountyvaccine.com. We have the most up-to-date information available there, and even additional information regarding the safety around vaccines for you to check it out. We are working to keep you as informed as possible, so we're using a variety of ways to do that. Last week, County Executive Coulter and I spoke with Oakland County seniors about our response to the COVID-19 and vaccination efforts. We answered questions from participating community members, and these town halls were held via a phone call and were recorded. The audio recordings are now available on our media webpage at oakgov.com/COVID if you are interested in listening. Remember, continue to tell us that you are interested in receiving the COVID-19 vaccine by using our Save Your Spot. Again, that list is available on oaklandcountyvaccine.com. When you are eligible to receive a vaccine and we have doses available, you will be contacted to make an appointment at one of our 10 and even close to 11 sites throughout the county. If you have used our Save Your Spot system, but maybe received a vaccine from another provider, please use a new feature on our website to remove your name from your list. This allows us to have a clean list of those that still need the COVID vaccine, and we can invite people quicker and get people registered and vaccinated faster. If you need assistance completing the Save Your Spot form or to even remove your name, please use our Nurse on Call line at 1-800-848-5533. Although we are experiencing a very high call volume, we are here to help you. So please call us because we want to answer your questions and assist you if you need help. Thank you for your patience when calling us. We look forward to vaccinating you and getting back to you and continuing to communicate with you. Thank you, Dr. Faust, for joining us today, and we look forward to talking to you soon.